Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender adult care. Welcome to my channel. If you have not yet had a chance to subscribe to this channel, I would very much appreciate if you do so. This way you are helping me and you're helping a lot of other people find this content. If you also don't follow me on Instagram, I would very much love to connect with you on Instagram. That's where I show up also daily to share with all of you tips, guidance, and lend you additional support. So do come on Instagram, say hello, and let's connect. For today's videos, I want to address an issue or concern that so many people experience. So many people reach out to me with this exact question, and that is, how do I know uh, when I'm ready, or how do I know if it's the right time for me to start taking hormones? This video is for adults. I can't stress that enough because I do not want any trolls to come after me. This is not for children. These are for adults who can make their decisions in their own personal lives. Now, I'm going to share with you some of tips, some of guidance coming from my experience working this field for a long time, ideally to help you figure out how to get to that place of readiness, or at least how to get to that place where you are more certain than less so. Having said that, I want to say that stepping into hormones is a very personal decision. And as such, some of the tips I will be giving you may not even be something that's conducive to your situation. But more or less, I think something in this video is definitely going to be very, very helpful to you. So, this question about how do I know if I'm ready for hormones um, is something that tends to bombard a lot of individuals' minds, especially if you are a young adult between the age, I would say 18 to age 25. It is something that is going to be orbiting in your mind. I find in my experience, individuals who have a history of gender dysphoria. Remember, not everybody who is trans has gender dysphoria. Individuals who have a history of gender dysphoria, and especially those of you who have a history of gender dysphoria where it is mild to severe, in other words, where it's at a point where it really is affecting your overall well-being, not only physical, but your psychological well-being. If you are an individual that is experiencing that, I would say that in those cases, for a lot of you, it has been and is much easier to step into hormones. By the way, this is assuming that everybody watching it or people who questioning when they're going to be ready for hormones or how to know if they're ready actually do want hormones as part of their transition, right? So just want to be very careful here because not everybody needs or wants hormones, and going on hormones does not define one's trans identity. So when you have that pain that you want to alleviate, and when you also receive knowledge from medical provider, a mental health provider, that hormones can be helpful in alleviating the distress of dysphoria, which undoubtedly they do. As a psychologist, I can tell you that because I've seen it again and again and again. Well, then it makes it easier to ask yourself if you're ready for hormones. Then the ready part, the readiness part, starts to circle more around whether your circumstances now are ready for you to do that, right? So there's difference between I'm not ready versus I'm ready, but maybe I need to wait until I come out to my partner, or maybe I need to wait until something else in my life is situated. Maybe I can wait until I move to a safer environment, whatever it is. But if you do have a pain point arising from gender dysphoria, it will be easier for you to make decision to step into hormones and to feel certain because you're going to want to alleviate pain point. Asking yourself, am I ready for hormones when you don't have a pain point becomes much more confusing, becomes much more difficult to figure out. Because we have to acknowledge that hormones are out there to help alleviate gender dysphoria distress, and yet not everybody experiences gender dysphoria distress. There are transgender people who do want hormones to transition. There's also individuals who want hormones because they feel much more, it's arising much more out of that alignment with euphoric feelings that they experience. So it becomes again that much more confusing. Am I ready for hormones, right? If there's no pain point, um, is this something that is going to be good for me? If you are one of those people who is wondering this exact question, I encourage you to think about reverse to that. What is my goal of stepping into hormone treatment? Ask yourself, what is that you're trying to achieve with hormones? Again, if you look at individuals who are experiencing pain points, it's easy for them to answer. If I ask them, what is your goal with stepping into hormones? They will tell me, oh my goodness, my goal is to alleviate this stress. I can't live like this. The dysphoria is killing me, right? There's an answer. For a lot of people, that's even an answer before they even can tell me that their secondary goal is to achieve physical changes that they want. But if you don't have the pain point and you're wondering and you want hormones, but you're not sure if you're ready, ask yourself, what is it that I think I'm going to get out of hormones? Now, this question is not to talk yourself out of it or talk yourself into it. This is a very important question to ask yourself so that at least you have a better and more clear understanding of not only what are you trying to achieve, but also what are you going to get out of it. I think a lot of people don't think this particular element through. I think that it's important, especially if you're not sure if you're ready for it, to ask yourself this question. Again, what am I going to get out of it? What am I trying to achieve? What are the goals of me going on hormones? What are they going to give me? A lot of people say, well, I want to go on hormones because I want hormones to help me figure out my gender identity. And in my experience, that is not a helpful way to approach it because hormones do have reversible changes, and hormones, if anything, can be affirming to the identity you already feel yourself aligned to. But hormones are not necessarily there to help you figure out your gender identity. Again, they are very affirming. For individuals who identify as women, going on feminizing hormones solidifies that sense of knowing. The way the hormones make them feel, the way the dysphoria eases up, it not only solidifies that, yes, this is the right hormone for my body, but it also solidifies that I'm on a right path. It also, because it decreases the pain point of dysphoria, solidifies that this is helpful. For individuals who are confused about their gender identity, and I have a lot of people reach out to me who are still not sure, am I non-binary? Am I gender fluid? Uh, am I trans-binary? Am I just transgender? All of the things. Thinking that the hormones are going to help you situate yourself on the spectrum, again, is not helpful. Because feminizing hormones, especially, is a feel-good hormone. Chances are it's going to make people feel good. But it's not going to immediately point out to you where you are on the spectrum, if anything. And both, by the way, testosterone is also, I'm not going to say testosterone is a feel-good hormone because testosterone is a little bit different hormone, but testosterone especially can produce quick changes. Estrogen can also produce quick changes depending how your body metabolizes it. And experiencing changes you're not ready for, or you haven't yet for yourself, you agreed that you want them, right? You haven't had the discussion with yourself of whether you want these changes or not. Experience them quickly while you're still not sure where you fall on the spectrum can further lead you to feel confused about yourself. It can further model your understanding of your gender identity. So if you're thinking about, well, I'm not sure where I land on a spectrum, so I'm going to start hormones and they're going to help me figure it out, I encourage for you not to do it that way. This is just my encouragement. You're all adults. You can do whatever you want, but this is my advice. Instead, my advice is first ask yourself, what am I trying to achieve with hormones? What are they going to give me? What are the goals? Two, what I think I'm going to achieve with hormones, what I think they're going to give me, the goals. What does it tell me about my relationship to my gender and my gender identity? How does that fit? Does it feel in alignment? Does it feel um, affirming? Think about all of those things before starting. This is how you're going to get to the part where you're ready for hormones, right? This is how to bypass that part. How do I know if I'm ready? Well, that's how you're going to find out. You're going to ask yourself all of those important questions. Another important question to ask yourself when you're wondering whether you're ready to start hormones is, okay, I'm not feeling pain point of dysphoria, right? Remember how I said pain point of dysphoria usually is a helpful way to help people figure out if they're ready for hormones, and especially if they want it. Okay, I'm not feeling pain point of dysphoria. Um, then ask yourself, if I don't feel like I'm experiencing dysphoria, physical or maybe even social dysphoria, how then overall do you feel about your assigned gender? Now, you don't need to hate your assigned gender to step into hormones. I've seen people who say, I don't hate my gender, but I just feel much more connected to maybe opposite gender or maybe to other form of gender identity. And that's something for you to figure out. But you have to ask yourself the square one question. How do I feel about my assigned gender? What is it about my assigned gender that doesn't fit right to me, that makes me even think or wonder about hormones? And what is it that the hormones are going to give me that is going to fix my relationship to my assigned gender? All of these questions are going to help you to get from a place of how do I know when to start hormones to now being more certain. So one of the very important thing in all of this is that most of the people, even people who do have pain points of gender dysphoria, are seldom 1000% sure to start hormones. Sure, there are people who are very, very sure. But again, even people who had pain point of dysphoria all of their life and really want hormones, because they've been dealing with pain point all of their lives, and maybe even got to the point where they are, how should I say it, almost got accustomed, not accustomed to the pain, but um, been coping with the pain all their life. That coping in of itself is still going to make people question whether they should do hormones or not. What I'm trying to say is that most of you were thinking about hormones, and even if you know that you're ready, and even if you have the answer why you want to do hormones, and how it aligns with all of your goals, and how it's going to help you, we still not feel 100% certainty. A lot of this is not going to feel 100% certain because there's a lot of reasons, and it's a different video in of itself. Part of it is because you've been struggling with it for a long time, and your mind has accustomed to playing both a prosecutor and a defense attorney inside of your headspace, which is your courtroom, and you got really used to gaslighting yourself left and right. Yes, this is dysphoria. No, look, I'm feeling better the next day. Oh, it is dysphoria because here it is again. Oh, no, it's gone. So I probably made it up. You do this again and again and again. And when the mind flip-flops back and forth, it eradicates an element of certainty, right? That's the nature of gender dysphoria, that for a lot of people, it is not constant. It tends and does often fluctuate drastically. And the drastic fluctuation of dysphoria is exactly what makes it difficult to attain level of certainty. Because again, those experiences of fluctuation create a gaslighting type of scenario where one week dysphoria is there, the next month dysphoria is gone, and you feel like maybe what you experience is something you imagined. So, what I'm trying to say is do not chase 1000% certainty. chase more understanding and having a more clear idea of this is actually essentially what informed consent should be about. To what extent do you understand the changes you're about to step into and what those changes are going to bring to your life? And why do you want those changes? How are they going to bring you closer to yourself? How they're going to help you alleviate things? But again, if you're hoping to step into hormones because you think the hormones are gonna help you figure out who you are, that is the wrong way to do it. Hormones can affirm who you are, but they will not help you fully figure out who you are. Comment below, let me know if you're feeling unsure whether to step into hormones or not. What helped you in your life when you felt uncertain to step into a more place of certainty? Ask your comment below if it was a pain point for you or for something else. I love reading all of your comments. Make sure you give this video a thumbs up and comment below as well. And I will see you all next time. Goodbye.